Welcome to this week's episode of Surgeon Interrupted. This week, I have Dr. Sophie Engelhardt joining me in the studio, all the way from Copenhagen.
Exactly.
And yes, it's such a joy to have her here. You know, Sophie has an incredibly interesting background. She herself is one of these physicians who is building what I would call a portfolio career. Like she's not just in the hospital. And so very excited to hear more about everything that you've been doing, everything that's to come, and then also how you navigated all of that.
Let's dive into it.
Yeah, absolutely. Okay, well, so for just a little bit of intro and background, can you tell us about yourself? You know, when did you move to Copenhagen, for
Yeah.
instance?
So I moved to Copenhagen. I relocated from Germany, where I'm originally from, in 2023 because I stumbled across a blog article online how the circumstances, work situation, working hours, education, residency was just everything you would ever dream of. And I didn't believe it. So first I did a short internship. I was so surprised that everything was true. Like 37-hour work week, clean labs. I was super interested in pathology, so I was used to like inhaling formaldehyde every
Oh,
day. And that's pretty normal, I figured. But in Denmark, it smells like tropical breeze soap because everything is just so clean and they have cabinets. So I was head over
wow,
heels in
that's like
love.
night and day.
It is like you don't get exposed to carcinogenous toxins at work.
That's the
Amazing.
dream.
The
Yeah, and
dream.
I've been to Copenhagen, maybe for about a week, a year ago or so, and yeah, I loved it. Like it's probably in terms of the vibe, the aura in the streets, the
Yeah.
young people filling
Yeah.
up like all of the restaurants and bars. I mean, it just truly was one of the most impeccable cities
It is.
that
It
I've
is
ever been
so
to. So
pretty.
I'm
Like
very,
you look left, you look right. Everything is like very expensive, but also very, very, very pretty and nice. So, yeah, I fell in love. I was like, okay, after I graduate in Germany, there's only one way. I need to get my foot into the Danish job market. So I learned Danish. I was actually fluent before I moved, because my university apparently had Danish classes at a very high level. And so I just signed up. You can do that in Germany. You can just study all of the languages on the side. So
wow. So like alongside your medical studies then,
yeah, actually, yeah,
right? I mean,
yeah,
what was that schedule like? So you just were full time, you're working on medicine and
yes.
then night class?
No, actually, it was the afternoons, like 3 hours twice a week, and then we would get homework. And it was also during COVID, so I was doing my
Oh,
rotations and internships during the day, and then in the afternoon because there was actually no one wanting to learn Danish. So I got private lectures for half a year. So of course I got very good at it because I was just chit-chatting with my teacher, and it was funded all by the university.
that's incredible.
It
And so,
was.
I mean, how long did it take you to get fluent?
It took me about 1.5 years to get fluent. Yeah.
That's incredible. Is
Yeah.
there, I mean, do you feel like you have a leg up knowing German?
Yeah, it is so, so easy to learn. Oh, sorry, that was just the door. It's
No.
really easy to learn Danish as a German, I would say, because it has the same root, like Germanic.
Oh, okay, gotcha. I didn't know Danish was Germanic roots, but that makes sense for sure.
Mhm.
Um, it's so funny because I speak Shanghainese,
Uh-huh.
which with Mandarin, you know, most people who speak Shanghainese, they can automatically understand Mandarin, but not the other way around.
Okay.
Kind of like Portuguese and
I
Spanish.
mean, I would say when you come to Copenhagen or Denmark and you're German, you understand a lot of the words, but the pronunciation is actually where it becomes really tricky. So that's really worth studying. And I would say even after 2.5 years in the country and 1.5 years of learning beforehand, I'm still struggling. Yeah.
When you go to work, when you're at the hospital,
hmm
Do you speak Danish
All
there?
Danish,
Is that
all Danish. Yeah,
oh,
it's really like sometimes I even catch myself thinking in Danish, so it's really taking overhand.
yeah, I mean, you've been immersed for a long time
So
now, and I
much, yeah.
guess my other I mean, but here's what's crazy to me. I just really respect it. I admire what you did because you went out, you learned Danish, and fluency, even in another language, is kind of one huge obstacle to surmount. But then medical Danish, I would imagine, is literally a whole other level.
It is, and I was really happy that I wanted to pursue pathology because then I don't have to talk to patients directly, but still my reports have to be so crystal clear in what I'm saying, right? So it was still like a lot of my colleagues were actually impressed by how well I can articulate myself. So they were also a big help and said, okay, here you need this conjugation, here you need this word. They were really, really helpful. And they're still like very, like in the beginning, they were mind blown. Now it phased a bit down because they've known me for 2 years. So they're like, ah. But in the
Yeah,
big,
yeah, they're
in
used to
the,
it.
in the beginning, they were really like, who is this girl? Where did she come from? What is this?
Yeah, that's amazing. I mean, I will share, again, solely having studied and then practiced now in the US. When I meet someone where English is their second language and they're a physician and they're doing it here in English, that's like not lost on me that,
It's
most of us
hard.
will never be able to do that, like would never be able to even grasp all the additional medical vernacular and ease.
Yeah.
So it's super impressive.
No.
Kudos to you on that.
Yeah, but now it's like really interesting because life took turns. Um as you know, I've been since a couple of years I've been having this dream and idea of working as an actress and it just came out of nowhere actually. So after I graduated, I took a half a year off because I felt so drained after all this studying without a break. I was like, okay,
Mhm.
how can I let myself live for a bit? So I went to Munich, produced vegan ice cream. I found the girl online. She had a startup, and one of my colleagues, she was working as an actress in Munich in the film studios. She told me
Mm.
like you can sign up here on this website, and I was so curious. I was like, "Oh my God, this is something I always wanted to try," right? So I just sign up, and I don't know, a couple days later, I'm already on set, and I got into costume for a police officer, background actor. They did my hair real nice, and you can even see me in the final cut, like my hair, but still me. And I was like,
Mhm.
this feels so alive and exciting, and I don't know, like I've really not had this feeling in medicine, and I didn't even know it exists. So then it got really tricky.
Yeah.
Yeah.
Well, I do. I mean, it's interesting. It obviously, again, you come off as someone who can do whatever they put their mind to. So, like, you kind of have like doors open to you and like these whole different worlds available to you. I can relate to your experience in the sense that before I did switch into like a medical school application, I did a lot of research, like
Uh-huh.
basic lab research and computational stuff on the computer. So I would imagine a little bit like pathology, just in terms of like it's
Uh-huh.
a little lonely. It's beautiful. It's like its own art, but it
It
is
is.
solo work and it's like you and the gels that you're running, or it's you and
Uh-huh.
your computer and you're
Uh-huh.
running a program. So
Uh-huh.
when I even was exposed to like patient facing care, I was like, wow, there's so many people. I could have like a new, meet new people every day and have these conversations. And um, when I got a taste of more of the creative arts and like modeling and getting to go to set, it was like,
Uh-huh.
it was night and day. And I was like, wow, there's so much here. And I love the aesthetics of it. And I love like this type of art. Not to say that the former type isn't really an art, because I think that what you do as a
Mhm.
pathologist,
It is so
that
much
is
art.
actually really cool in an
Yeah.
art. Yeah, exactly, but I think the expression's different. Obviously, maybe some of
Mhm.
the community component of it is different, some of the energies. Can you speak to that a bit?
I mean, in the beginning, I was super intrigued by pathology because it is very beautiful. Like, it is pink, like the eosinophilic, the HE stains. It is art when you can dissociate from what's happening. But then again, like my day-to-day work was diagnosing colon cancer, breast cancer, endometrial cancer, and I also dived down into like I could relate too much to my patients without even seeing them. And just the idea of helping them before they even get that sick motivated me to like verge onto this different path of preventive medicine instead of diagnosing, even though it's so important to know what we're facing. So many chronic illnesses and cancer are actually preventable. So I felt so stuck. Like I felt stuck privately in my creative endeavors because it wasn't very
Mhm.
flexible. And I also felt stuck in my point of view as a medical doctor to help people in a meaningful way for myself. So yeah, it was really a lot
That's
of
very
thoughts.
Yeah, no, absolutely, and that's a very beautiful I think that's a poignant thing that you're pointing out there. It's true because 'cause you're at a point in their diagnostic journey, in their patient care journey of, yes, diagnosis, confirmation of sometimes probably horrible disease, and
Mhm.
while that was a part of my ENT practice, the diagnosis, new
Mhm.
cancers that walked in off the street, like
Mhm.
biopsies that I was taking and then news I was delivering, I will say that was not more than a quarter of my
Yeah.
practice. And interestingly, I would say I have similar interests to you, where like what I loved in ENT and what I loved in clinic was like medical management type of preventative stuff, like improvement without
Mhm.
really surgical intervention, more like medical laryngology and allergy and stuff like that.
Mhm.
Cause I could try to just catch them sooner and say, hey, if you don't take care of this, this is going to be a much bigger problem in
Mhm.
X or Y or Z
Exactly.
years.
I was just talking to a colleague and she got diagnosed with ulcerative colitis, and the doctors were just telling her that she could continue with her diet. She was asking into it. And there's so much research on, for example, using a whole food plant-based diet to not only
Right.
limit the symptoms, but also the steroid treatments, the surgery, also, yeah, the outlook of this disease, and even not getting it in the first place. So I was shocked when she told me that the medical doctors treating her are totally ignorant towards science and new results and nutrition. So I think there's a lot to be done, and I feel like very deep motivation to tackle this.
Yeah. Well, that's amazing. Okay, so are you still like catch us up because I'd love to hear about part of your pivot, part of your next chapter.
Mhm,
Like you're still working in the hospital now, but I'd love to really hear about you walked us through your first time on set, but
mhm.
like, yeah, what happened
What happened
between then and now?
afterwards? Yeah. So when I had this experience back in 2021, I think, or 2022, um, I thought, okay, I allowed myself to have fun for half a year, and now we're going back on track because you studied medicine, young lady. You will have to pick a residency because that's the way it is, right? That is the path. Otherwise, I would have wasted everything, right? Um, I don't agree anymore, but that was my way of seeing it back then.
Yes.
Um,
That's the party line for sure.
They're like, "What are you gonna do now?" Where so I applied to a couple of hospitals in Germany, but I quickly found out, I didn't like the working standards and the chemical exposure, all of that. But my path to pathology was very clear. So I sent some applications to Denmark, and actually after the second one, I got invited to the biggest and best hospital in entire Denmark, the University Hospital in Copenhagen. And I went to the job interview February 2023, and just 12 hours after, they called me and offered me a position.
May I ask, was that interview conducted? in Danish?
Yes, and I haven't been talking Danish for 2 years. So before the interview, I was looking up like nice adjectives to describe yourself as a hardworking person. I remember it clearly. I was like, how can I describe myself? Because
Wow.
I've never learned it in Danish class. Yeah. So
Wow.
winging it,
Okay, but clearly you killed the interview.
apparently. I mean, I do have a research background in neuropathology. In Germany, we do these doctor meds, also parallel to
Mm.
our studies. Some of us, not everyone, but I've been doing experimental research on low-grade gliomas, and it for 5 years actually while I was studying. So I started in the fifth semester and published research to this topic. So it was very like fitting to the role. So I think that was a big advantage.
Wow. Sure. Absolutely. But I mean, I guess that especially because like myself, selfishly, and I think like a lot of our listeners from around the world, it's like what you did is just incredible. We've talked a little bit. Like, I love Copenhagen. I'm always trying to get to Copenhagen, but it's like, I don't know Danish. I would surmise that a big part of that door opening for you was all of the prep work, the literal courses that you
100%.
took, the Danish prep that you did, and you have some Germanic, of course, language background that's very
Hmm.
strong. So it's incredible. But I think a lot of us, when we hear stories like this that are like so inspiring, it's also like, how can I
Yeah,
replicate that?
we came prepared. So it's all about the preparation. I mean, I think I signed up for my first Danish class in 2019 and the actual job I got in 2023. So there's so much work before. So you can't underestimate the effort.
Yes, and that's really important too because again, I'm just telling on myself, like I'm a very impatient person and when I see someone, when I hear these stories, it's so quick to feel inspired and then even feel that pressure like,
Hmm.
oh, I want to do it.
You need
And then why
time.
not me? And
Yeah.
kind of like that whole spiral. But people never see when people look at that stuff and they envy it, it's like they never see how the sausage got made. And they didn't see you for 4 years, preparing for this big interview. So I digress. Take us from 12 hours after the interview. Now you're
To
in
know.
and
Yeah, so I was driving this first year. I was just totally blessed. We got gloves and they told us to change it every 30 minutes. They were really looking after us. We got gloves to protect our arms compared to some cotton like coats we got in other labs where I worked before. So I was head over heels in love with everything in the pathology department, the education, the teaching, everything was amazing. So I was just flying because I thought, finally, I found my place where I can practice medicine how I want to. Um, got into the residency programs in Denmark is split up into two parts. 1 year to find out if you like the specialty, and the rest from pathology is 4 years to know if the specialty also wants you. So you have to get the job
mm,
twice. And after I got the intro, like the first year, I applied for the main
mm-hmm,
part, 4 years, and I
mm-hmm,
also got it directly. So that was really like everything was
amazing.
on a roll, but also parallel, it started that I got booked more for both modeling jobs and also acting jobs, and this joy and passion and doing things that are really fun and not only like the responsible thing to do for everyone else, they became such a big part. And in the end, I actually couldn't fit it in anymore because I felt so miserable when I had to decline and decline and decline all these jobs for acting. I also was offered an entire month playing in October here, but I couldn't say yes because I'm working full time, right? And
Right.
I really took a long, painstaking look at myself. I was, what do you really want? Like, do you want to do the thing everyone expects of you and says, oh, well done? Or do you want to try something that actually really fills your cup, even though it might create some backlash from society because I'm not filling in that role anymore? And I've seen too many cancer diagnoses at a young age and too many autopsies. I was like, this is actually the thing where you have to do. And if it takes my courage to do that, then I'll try. So I quit. It's my last month at the pathology department this month, so November I'm gonna be freelance.
Oh my gosh. Well, hey, congratulations. The leap of faith. Obviously, I understand. I really do. I think that you have a good head on your shoulders. And when you talk about these younger and younger cancers that like walk into the hospital and like you said, the autopsies, like time is not guaranteed. So I do feel really good about the leap of faith and the risks and the rearrangement that I made in my life
Mhm.
earlier this year.
I can see it on your channel. So I just read that post today when you said the soft is the new hard, or I don't know how you
Yes.
from
Oh, I said, come back softer, not stronger.
yeah. So like allowing yourself to not be that hero in a way, or maybe even like you are a hero to many people because you show them that it's freeing and liberating to follow your gut and your heart. There's always going to be these two types of people, ones that shame you because you didn't stay, and the ones that are actually so grateful that you're talking about it and showing a different life design because they actually long for it.
Yeah, exactly. I do think that with the coming back softer and not stronger, like from my sabbatical and thinking this through, what I always am going to push back on is this sense, um, people like us, literally, even just anyone looking at what you've done in the past half a decade, what I've done in the past decade, we are strong enough. Like being a quote unquote stronger person, literally, that's not a problem that we have. Like
No,
I would actually, and I'm not saying that in like a braggadocious way. I'm just
no,
saying, let's call a spade a spade. We're tough. We are strong people. And speaking just for myself, I would say my main problem is that I have not had much softness. Like,
yeah,
I already had this personality type. I love working hard. I went through the whole journey of a surgeon. That only hardens you.
it
So I
does.
became this just like uber rigid, uber surgeon personality. And like my main problem wasn't like, oh, I need to be tougher. I need to be stronger. I'm fine. Like
Yeah,
I'm good.
you're
That's
good on
not a
that.
problem I
Mm-mm.
have. I needed to be softer. Exactly.
Yeah, I
Like
think it's very
be
funny.
softer and even more for
Oh, I'm sorry. Yeah, it's the forgiving. I was saying like giving your
yeah.
allowing yourself to try things and not be so rigid because I think like it's funny, but I was asking my boss for part-time actually before I decided to quit entirely because I thought maybe I can juggle it and maybe work 3 or 4 days a week and
Mhm.
then 1 to 2 days maybe on a film set or doing some commercial shoots or whatever my workshops on plant-based nutrition, and I was like seeing this as a good mixture, alternative, compromise. And my boss literally said to me, "You have to commit for once in your life." And I almost laughed because I mean, like, what do you mean? I became a medical doctor. What do you mean commit for once in your life? Like, it was so,
Yeah, it's so dismissive, but that's what I mean. Exactly. You've been committing. You've
yes,
been
so
committed and
much.
you've been committing, like worked, like you said, you worked all the way through until that 6 month break that you took
Yeah,
after
actually,
graduating.
just
Like,
to, yeah,
exactly.
yeah. And I was like, how, how can you even like say this with such a serious tone, telling me that I have to commit. I'm like, my entire life I've been committing, and now I'm actually letting myself have some space and freedom to explore creatively and to actually feel more like myself than ever before. So the thing I did, I listened to her advice, I committed, I just committed to myself and not the residency.
I love that. But exactly, like that might have been the first real commitment to yourself. And, um, I was talking to one of my friends, Mel, the other day, and she said something that really stuck with me, which she said, you can't truly love what you do if you don't know who you are. And so that's part of it for me because like I was committed to medicine and like it was very true that whole time that I was like applying in surgery and like working really hard to get the skills and like blend in and be a surgeon. But I think that because I didn't know who I was and I didn't do any work to know myself or solidify an identity outside of medicine. So me picking that, it just was like seemingly less accurate than
Yeah.
like a choice I make now in my life because
Mhm.
I do know who I am and what I want.
That's so true. Like, I think it's very important to realize that you will reach the goal, but it's not important for us to reach that goal because we eventually will, but to choose and pick that goal wisely. Because otherwise, we're just running in a direction and we will get there because we're very committed and very strong willed and very determined. Also, workaholic, maybe a bit. But then we end up somewhere where we didn't even want to end up because we didn't know ourselves.
Yep. And that to me is like the scariest thing, like where you just let life happen to you.
Yeah.
And I know it's scary because I've literally experienced it. Like even when I look at the past decade of my life, like I don't even know how I'm 34 right now. I actually think I just let the last 10 years like
Yeah,
happen to
maybe you're
me and
12, right?
now
Yeah.
yeah, and
Yeah.
I just got like spit out here. So that's totally fine. It's fine. I'm not going to beat myself up about that.
No,
But I definitely feel like, again, to use another quote I love, when you know better, you do better. So I'm just not going to
exactly.
like continue to let life happen to me.
Yeah. It's really interesting because right now I'm navigating this situation of leaving clinical medicine to both work as an actress and to talk about plant-based health and nutrition. And like there's so many things happening at the same time. Um, and then there creeps this fear in, like, maybe I should look for another stable job in the hospital because that's like our brains are so addicted to safety and the known, even though we know it's not for us. We're like, how can I stay safe? How can I get money? How can I do this and that? And it's so like you really, really have to keep yourself on the tracks of not falling into old patterns because you eventually will when you let yourself. So I'm really
Totally,
yeah, really thinking about that, not to get scared too early and really give it a chance.
totally. I mean, I'm lucky because I think I just ask my husband like a couple times a week, am I safe? Am I secure? Should I exactly like what you're talking about? Should I like try and dive back into and hide in a hospital? It definitely
Mhm.
like I get what you're saying. I think that it happens to me now that I'm like 6 months out.
Yeah.
It happens less and less. And here's what's good. Here's what's different for me at the 6 month mark cuz you're about to start. You're kind of at month 0 and I'm at
Mhm.
6 months. I am not at the point of like I've overtaken all fear and I don't ever experience fear or anything like that. But what is nice and what's different is that if I feel like I'm sliding into a scarcity mindset almost, or I just feel like, okay, well, what do I need to do that's stable? I am finally at the point where even if I yearn for something stable, oh, let me try to do this or this, it's not in the hospital. I literally have consulting roles and I do work that is regular and kind of stable, but
Mhm.
I feel so good about when we're raised in the hospital the way that we were, like, all you know is the
I
hospital. So
mean, I
I'm
was
like, even if I
17. I was 17 when I first started these internships and got into these dynamics and hierarchies, nurses, doctors, being a female doctor or med student. Like there are so many things that just stain you.
Yep. But it's just even if it hurts you, it's all that we know. So like I didn't know what jobs were outside of the
No.
hospital and just truly now I am I have left the tunnel. Like there's a whole world out
Mm.
there. And so even when I need more stable work or X or Y or Z, I'm not going back to the
Looking in
hospital
the
for that.
hospital. Yeah.
Exactly.
Yeah.
Like that's not I feel really good about that. And that was like the last cutting the ties and
Yeah.
just have
Cutting
that's what
cords.
freedom feels like for
Hmm.
me. So I mean, because again, look at your skill set. your varied skills, your varied interests. Like, I totally even get what you're saying about regular stable work, even if it's as a freelancer or whatever, like, capacity it's in. But it just sounds like you can make it work in a lot of places other than the hospital if you want to.
I think it's mostly projected fears, like from my colleagues, from my family. By the way, nobody in my family works in medicine. So I couldn't have been warned. But still, it's like, do the stable job. I'm like, but what if it like kills me slowly and takes my soul? Doesn't matter. It's safe. It's stable. And I'm like, yeah, but actually I want to try choosing safety and or finding safety in myself.
That's very powerful. I cannot wait to, follow along your journey and definitely be cheering for you as you go out next month. I would love to hear, like, are there any recent projects in the past year that really stood out from your creative acting modeling side?
I am so blessed because just this weekend I sent a self-tape and I got an immediate response. I'm part of a movie we're filming in November here in Denmark,
Oh my gosh.
and the director wrote me a direct mail and said that she loves my energy and that she thinks I'm really good at improvisational play and she's looking forward to working together with me. And I was like, yeah, I was really happy because it was such a good feeling. It's like I'm stopping in November. I got some smaller things coming up, some commercials, some bit player things, but actually being part of a movie.
Mhm. That's incredible.
Yeah.
Uh, is it, like, near Copenhagen, or are you outside the city for
It's outside
filming?
the city. It's on a neighbor island, and I think it's gonna be lovely.
I'm excited for you. And
Yeah,
again,
thank
I
you.
really, you just gotta tune. I do think that there's a lot of benefit to just tuning out. Um, Here's how I look at it. If I wouldn't want to trade places with you, then I'm not really going to take advice from you. So, like, that's not to say, oh, I just tune out all advice. And if my
No,
trusted
right.
friends
Yeah,
and my family tells me something,
yeah,
no, I mean, I got to
yeah,
listen to them. Those people,
exactly.
I respect their opinion and I want their opinion and I'm going to take it seriously. But yeah, someone who doesn't know me online,
Yeah.
uh,
Also, like how I triggered myself into making this radical change was really visualizing every day how I will sit there with 49 regretting that I didn't take the decision or that I didn't take the leap of faith and I was seeing myself in a job that is too boring for me. It's too boring.
the mental exercise that you're describing is just so scary and uncomfortable to most people that they will never do it. And I really, that is sad,
It's the
you
like
know?
very powerful visualization technique to actually look around, see how the people's lives are looking like because I was living in a fantasy world. I was like, I'm gonna be a pathology specialist, I'm gonna be a consultant, I'm gonna work like a couple days a week, I'm gonna work abroad, everything is digitalized. No one even has home office at my place, even though it's an option. So like some people do like
Mm,
but it was like my fantasy of what it could be and checking it
mhm.
with reality how it is as of now, it didn't match. So I was working towards a fantasy, and I had to realize that in the end that no matter how much I wanted it, it wouldn't be like this.
Yep, yep, and there's only so much that's under our control in that
Right?
regard.
Yeah.
Because
Because I realized even after asking for part-time and I asked for a 90%, like one day every other week off, they were
oh
like,
my gosh.
no, no. And I'm like, okay, then, well, like, yeah, I can't spread
So
myself.
yeah,
Yeah.
I no, I get it. And again, like, this decision's not taken lightly. So of course,
No.
and yeah, I'm biased. Like, you don't need to describe it to me, but this goes back to, you guys, this is our first time ever like e-meeting.
Hmm.
We've messaged each other a little bit. Um I just say that to emphasize that, like, we've known each other for about 30 minutes and you don't need to convince me. I think it's very clear to me that you are a serious person, a thoughtful person, a very competent person. So if you encounter any of those comments like, oh, this is classic women in medicine, like
Yeah.
you're a
Oh, how
floozy,
could
you just gave up
yeah.
because you're weak.
How couldn't you know earlier? So I got these comments under some of my videos. I mean, I didn't know. Like I just didn't know, and
Yeah.
it's very hard to have this inner conversation with you because you know how long we've been working to get at this place and how many frogs we had to eat and how many times we should didn't say anything and how many times we just let our feelings or pushed our feelings aside so we can actually not stand in the surgery room crying. Like so many times we've just been dismissing our feelings. Even yeah, yeah, we all know these
Yeah.
type of things. Like and continuing and thinking it's worth it and then at one point saying maybe it's not. It's not easy. Like it's not a like day-to-day decision. This takes months, this takes years. For some it just takes one incident in a day, good for them. But normally this has to ferment.
Yes. For most of us, for both of us, it sounds like it had to percolate for quite some time. And again, like, um, I think I just say that to remind you as you go into the transition time. All transitions feel like a little bit of an upheaval and they feel a little tricky. Like there's a lot of
Mhm.
emotions that come with transition times, but I do hope that you have your support system and truly know within yourself like it's just not a question. I mean, there's not really anything anyone can say to me to convince me that I am not a strong or serious person. Because,
Yeah,
like I said, I actually have a ton of flaws. Those two are not
not one of them.
them. So, you gotta come up with something else. Like I know I'm very aware of what a lot of my flaws are, and um, but that sense just comes from within, and I hope that
Yeah,
you feel really resolute about it
I
as you
do
go into your
actually.
transition.
Yeah, I think it was very freeing talking to my colleagues about this because now I'm in this month period because we have 1 month like resignation time. So when we say to the end of the month that we want to stop working, we have to work a month. So
Mhm.
actually I decided
Mhm.
to tell them straight away and not on the 31st of October that I'm
Mhm.
stopping. So we could all settle in this a bit and it wouldn't come as a shock, but something we already like digest and yeah, work through. And a lot of people were surprised, but honestly, most of the people I talked to were happy for me because they could see like how my energy changes when I talk about the things that I want to do. And some of them actually were like, if I could, I would follow you. And that made me sad.
Yes. I've received a lot of that commentary as well. Again, I think that the people who really freak out or they try to yell at you or make you feel bad, I do think that that comes from a place of unhappiness within themselves because truly, and I have many friends who are doctors, who are practicing clinical medicine, who are happy. And their reaction for me was, I'm happy for you. Right? Because
Yeah.
they're not, but it is tough because if they themselves are miserable and they see somebody get out, some people just lose their minds. And again, even some doctors that I know who, were acquaintances and they're happy with their career, they might feel neutral about me leaving. But if you don't feel like neutral to positive, like the people who really go
Mhm.
the other way and they're angry about it, that's because 'cause they're angry about their own
Yeah,
stuff.
there's
That's, like,
something
really has
hiding.
nothing to do.
Yeah.
Yeah, it doesn't have to do with you or me or our life decisions.
No, it's actually the people that really just are calm and content in their own decisions, living a life. And that's actually the thing I'm trying to talk about and what I'm trying to show that you're living your life for your own sake. And when you're happy with the things you're doing, you don't get upset when another person does the things she likes doing.
I would even take it a step further for me, like, when I had the career that I did not want, and I really didn't like it there, and I just hated it, everything made me angry. I'm
Mm,
saying even whether or not someone's leaving medicine, just literally like the tiniest things every day made me really angry.
yeah,
And it was because I was in a job I hated. So
yeah,
like to your point though, now it takes about 1 million times more to get me riled up. And it really, like, I just don't get riled up. I'm happy as a clam. That doesn't mean that I'm, giggling to myself or just
no,
suddenly like so smiley. Like my maybe core disposition is the same, but it's quite peaceful over here.
I'm really happy for you.
Thank you. I'm excited for you as well. Well, as we kind of wind down here, I would love to hear, you're within your last 30 days now. Do you have any plans, any celebration? What are you going to do on the last day? Do you have a special spot you go to?
I mean, I'm gonna meet with some friends and we're gonna have a Halloween dinner. So it's just nice. Yeah, um, just some cozy, casual meet up with my friends and enjoying time with them, being happy for taking the decision to prioritize myself. So
Yeah.
it's
I,
really
I mean, I
beautiful.
love that.
Yeah,
Cheers to you.
thank you.
Like that's huge. Um, well, it's funny that you say like a cozy kind of evening because how do you pronounce Hygge?
Hygge.
Hygge?
Yeah. I
Is that
just
pretty
had to
close?
I,
Because
I had to like it's the cozy Danish thing, right?
yeah,
Yeah.
yeah, exactly. Because
Hygge. It's
yeah,
hygge.
Hygge,
Hygge.
Hygge,
Yeah.
Hygge, Hygge. Because yeah, the Americanites. I've never heard it, obviously, but I actually have a book of it, like the book
Yeah,
of
the Book of
Hygge.
Hygge. You find it everywhere in
Yeah,
Copenhagen, in the train station, the tourist spots. Even my grandma gave it as a present to me, like the art of Hygge, like putting a nice little
that's amazing.
candle and a
Yeah,
cup of tea and reading
blanket.
your book and meeting with friends. Yesterday, I had a Hygge session with my friends, and all of a sudden, more and more appeared, and we were just eating pastry at this vegan amazing bakery in Copenhagen. Um, yeah, it's the Hygge life I'm living.
That's incredible. I'm very happy for you. I'm definitely all about that life. My favorite bakery out there was Heart,
Oh yeah.
which I know.
Yeah, the one of the most famous. The one I really love is called Kaf. It's just
How's that spelled?
KAF.
Okay, gotcha. Yeah, well,
It's really nice.
I'll
Oh
have
my
to
God.
check it out. Amazing.
Oh, maybe they will give me a free pastry when I make a
Yeah,
public
seriously, for
shout
the
out.
shout out.
Yeah.
Exactly.
Oh,
Well,
I love them.
it was such a joy to have you on here today. Do you have any parting words of wisdom for us?
Spend 10 minutes a day not looking at your phone and trying to be with yourself.
I love it. I second that. Again, when I started having a practice like that, doing my meditation, starting 5 minutes a day, up to 10 minutes a
Yeah.
day, that was maybe 1 or 2 years ago. And like, look at how much my life has
Yes.
changed. When I never gave myself 10 minutes off of the phone
No.
to get to know myself, I could just kind of keep squashing it down and continuing.
Yeah,
So that's great
you can
advice.
continue always, but it's really brave to stop.
I love that. Okay. Well, thank you so
Thank
much.
you so
Um,
much.
Dr. Sophie, we will link your handle and everything in the show notes. She is showing us, behind the scenes of some of her
Yes.
gigs. Yes, sharing some of her old hospital life, but very excited to see like what the next era holds for you.
Oh, thank you for having me and see you online. And all the
Yes,
best to
catch you
you.
online. See you in Copenhagen, hopefully, when I
Please,
get
I
back out
invite
there.
everyone. I invite everyone. Please visit me. Let's do the hygge.
Okay, say less. Thank you for tuning in to this week's episode of Surgeon Interrupted. If you enjoyed the episode, please subscribe, rate, and leave us a review. Until next week, remember, it's brave to stop every once in a while.